Deputy Speaker, and like so many of those who have come before me in this debate, I'd like to express my condolences for those who have passed away across the board as a result of COVID, but in particular in relation to those who are living in aged care facilities. There are so many things that one could say. One death is too many. Of course, all of these things are correct. One of the things that strike me perhaps the most is that, as a relatively young person still, I think we have a vision of what our own deaths might look like, and hopefully we'll be surrounded by our loved ones when we go. We might be at home, we might be in a hospital bed, but we like to think, I think universally, that we'll be surrounded by those we love. We can tell them we love them. And this is perhaps one of the saddest parts of those who have suffered from COVID and those who have passed away, is that by and large that's being done without their family being there. And that's a great source of sadness and sorrow. And likewise, as a result of the restrictions, we haven't often do we have the opportunity to say our goodbyes at their funerals. My parents are elderly. They live in Melbourne. I live in Queensland. I worry about them down there. I know that those members here who live in Victoria are living in a totally different world to what I am in Queensland. And I hope that Queensland never goes the same way of Victoria. But those opposite talk about that we have no plan, and that is fundamentally false. Like the member for Barker who spoke previously, and so many of those on the government have indicated, there has been a 6-point plan which has gone back to January and been implemented. Now, there are 8 separate jurisdictions in the Commonwealth of Australia. If there was no plan, we would see the same sort of problems being replicated across those 8 jurisdictions. That is not what we are seeing. We are seeing a problem specifically in Victoria. Let me just, as far as the deaths in Australia are concerned, across the whole country, the number of cases of those contracted or who have contracted COVID who are living in an aged care residential facility number 1,761 across the country. Deaths 328, or if you add home care to that, 335. Now, the Victorian component of that is 1,698 cases, or 96% of Australian cases. Deaths 297 in Victoria, or 91%. If those opposite were correct, if their philosophy, if their principle, if their policy, if their suggestion that we have no plan, why is this predominantly happening in Victoria but essentially nowhere else? It's because their hypothesis is incorrect. Now, no system is perfect, and I don't say that as some sort of a justification, because I go back to my earlier comment, one death is too many, and one death should cause us to pause and look at how we can improve the system. And that is exactly what we are doing. This is not a set and forget. The Health Minister and the Aged Care Minister are working very diligently and very hard to ensure that we do not have what we're experiencing in Victoria replicating across the country. But it is sad. I want to join with the comments of the member for Barker. It is sad. This is a time for us to come together as a parliament, particularly in this whole COVID crisis, we need to come together and support Australians.
Members' time has expired.